The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello to all of you TMD warriors out there. We are gathered here for the next episode of TMD Demystified, and I am Tony Urbanic. Today you may see me in my doctor uniform because my associate, Dr. Urbina, is on a charity vacation. He is doing charity on his vacation time, and I am doing double duty here on Tuesday when I always record these episodes. So today we're going to talk about some things that came up just yesterday when I saw patients that I think will drive home a few comments that I previously made about using the Urbanic device and protocol. Part of what I have to say and what I teach has everything to say about really what's going on with the misunderstandings of TMD from both the patient's point of view and the doctor's point of view. I have seen so much of it, both treated it surgically and now for the past 12 years non-surgically, that I'm hardly ever surprised about what I hear from patients and from professionals, or hear about professionals or about professional services regarding TMD. But there's a thread that runs through the whole problem of TMD, and that is miscommunication or misunderstanding, which are similar phenomenon. If you miscommunicate, you end up with a misunderstanding. Or if you have misunderstanding, then you try to communicate about it. You can't get any truth across or any effective truth across. But the point is that there is a lot of miscommunication, both from a patient point of view and a provider point of view, a professional point of view regarding TMD, TMJ. And I had three things occur just yesterday in my patient list that I thought I'd bring out and talk about that I think will make the point. I think that sometimes I'm going to run out of things to talk about. And I was way ahead of myself, and I had listed topics for 3 separate episodes that I'm looking forward to delivering. And then I put this one ahead of the other 3 because of the timely nature of it and the important nature of it. But I'm going to kind of give you the titles of the 3 that I'm going to be producing in the relatively near future, the titles may not make sense to you, or you'll be questioning it. But number 1 is periodontal disease and TMD, and the similarities and the importance of understanding both. The second will be entitled something like, we have been given a phony roadmap for TMD. And the third is going to be entitled, why doctors and patients want to make TMD so complicated, because it's not. But for today, we're going to talk about patient contacts I had yesterday. And we get patients in this practice, not only from Middle Tennessee, but yesterday I had patient could come in from Florence, Alabama, which is about a 3-hour drive, and from Batesville, Arkansas, which is about a 4-hour drive. Each of them were a little different situation, but each of them were examples of what I wanted to get across to you if you are treating or considering treating, but especially if you're already treating TMD, especially if you're treating TMD with the Urbanic device and protocol. Because this device, as I've said many, many, many times, and this is the older model, not our new model made on the computer and 3D printed, but does the same thing. This device is a tool. It's a tool, and you have to learn how to use the tool. So the title of this episode is going to be The Urbanic Device is a Tool with Instructions Included. And it's important that those instructions be communicated to both doctors, referral sources, or providers, and especially the patients. So let's just get into it and talk about the examples that I had that tripped my interest in telling these stories to you today. Number one, I had a patient was referred to me by one of our providers who sees patients using our device and protocol from Florence, Alabama. And she had this patient under her wing for about 2 months, and sent the patient to me because the patient was not getting the results that they wanted. So that's fine. That's good. I'm happy to kind of sort it out. But sorting it out is the story here. There's a point I want to get across. And again, it's all about proper communication and understanding the fact that this is a tool and that you have to understand the instructions and how to use it. So this patient came in yesterday. First name was Sandra, an older woman who had been using the device for about 2 months, and her initial symptoms included pretty much the panoplia of all the usual symptoms: headache, earache, jaw pain, neck pain, ringing in the ears, feeling a fullness in the ears, dizziness, vertigo, and some shoulder pain. And she referred in because, according to my schedule, that she was not getting results. So I found this interesting. I wanted to find out exactly what's going on. So I basically walked in the room and introduced myself, and then kind of ran through what the problem was. And she said that her ringing in the ears was not getting any better. And I went through the symptom list and confirmed that she had the majority of the symptoms that are usually seen with TMD: headache, earache, jaw pain, neck pain, ringing, fullness, dizziness. But she said, my ringing's not getting any better. Now, again, for those of you who've taken the course or listened to the appropriate episodes that I've already recorded, you know that tinnitus, not tinnitus, tinnitus, which is ringing in the ears, when it is present, will almost always be the last symptom to go away. And I tell patients on a daily basis when we do consults or when we deliver the device, and it's very explicit in the episodes on Dentaltown, and also especially in the course that's available to doctors who want to be providers for the device and protocol, that tinnitus will almost always be the last symptom to go away, and may take many, 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 many months, as much or more than a year sometimes. And I won't bore you with the stories, but I have several people who have presented with just tinnitus who take 6, 8, 12 months for the tinnitus to diminish and die down. And sometimes I have to call them up and say, what happened? We didn't see it. We don't see you in the office. Didn't keep your appointment. They say, oh, my tinnitus went away. Well, why should I come back? So we have that happen. But the point being, this woman who had been given the device elsewhere was not aware that tinnitus is the last symptom to go away. She had not been informed of that. And I asked her, well, how about all the other symptoms? And basically her response was, yeah, my pain has gone away. My headaches are gone away. My ear pain's gone away. My neck pain has gone away. But my tinnitus, my ringing in the ear is still there. And that was really what was bothering me the most. Well, admittedly, if that was her primary symptom, that takes top dollar. I mean, you need to address that primarily and discuss it with the patient and make sure that that is addressed and the patient understands. But it is a good example of that particular patient who had actually, she didn't have bad response from using the device. She had good response. Her painful symptoms and the other symptoms of fullness in the ears and any symptoms of vertigo or dizziness she had been having were already gone. And she admitted that those were fine, but her tinnitus, her ringing in her ear, was still there now 2 months after starting using the device, even though the course and the episodes and my constant statements that tinnitus, for a reason I don't know why it is the last symptom to diminish or go away. You have to be really consistent and you have to be very patient. So that was the first example of a patient who, for whatever reason, and I'm not criticizing the doctor in Florence, who I know well, and she is a great doctor, a great dentist, but somehow or another, maybe the patient actually heard it. Maybe she was told that tinnitus, takes a long time to go away, but she didn't understand it. She didn't get the communication. So it's irrelevant of how it happened. The point is, she did not have the full communication understanding of how and this thing works and what she can expect from it. The emphasis is all on getting the proper information to the patient, proper information to the referring doctor, proper information to the treating doctor. The second patient that occurred yesterday was a patient who drove from I get this right, from Batesville, Arkansas, and her initial symptoms were jaw pain, locking, can't open my mouth. Those are her chief complaints. But on history, she had the remaining symptoms: headache, earache, neck pain, tinnitus, fullness in the ears, vertigo, shoulder pain, arm, hand, finger tingling and numbness, jaw locking, and inability to open. She had these symptoms since she was 15 years old. She was born in 1988. So that made her roughly 35. So she's had these symptoms for roughly 20 years. And in this particular case, again, happened yesterday, she had been told down in Batesville, Arkansas, she had seen several doctors, and she had been told that outside of surgery, there was nothing that could be done for her. And that, and the surgeon had made a recommendation, but she clearly didn't want surgery. That's what her statement was. And she apparently did some kind of investigation and ended up in Brentwood, Tennessee, in consultation with me. The point being is that if the patient had not had a aversion, for whatever reason, to surgery itself, she would have undergone a surgical procedure significant expense, significant postoperative pain and associated problems. I'm well aware of how that works because I admittedly, as you know, have done 2,000 temporomandibular joint surgeries in my career, early in my career, throughout the first 30 years. So again, it's a matter of, understanding what is available and not having a misunderstanding or miscommunication. In this case, she was heavily miscommunicated that there was nothing other than surgery that would have fixed her problem. Now, in this case, we have not yet delivered her device. She did get a device. We took impressions yesterday, and once delivered, I fully expect her within a few weeks to a month to have significant improvement on her painful symptoms and ringing, fullness, dizziness to eventually resolve, but taking much longer. And that is expected. And I tell patients, I expect it, they should expect it, and they do. And as to summarize, the only patients that we really have any problem with achieving what I promise and what we say will happen is patients who won't follow the protocol. And we've talked about that. I have an episode on, I think I entitled Patients Who Don't Want to Get Better, which is part of that subset is patients who won't follow protocols, just part of it. And the third patient that I saw yesterday came in from where was she from? I don't see it here, but she had was still having. She is a local patient, and she had been given the device by my associate, and was not one of my patients. But I was seeing her, and she came back with a chief complaint. Again, similarly to the patient who was still having tinnitus, and her major complaint was still having vertigo. And in this case, it was a little different color, a little different flavor of the, how I presented, or she presented the problem and I addressed the problem, because this patient did not speak English. She was Cuban origin and brought her granddaughter in with her to interpret. And I do remember them well when I did an initial consultation, and I do standard consultations. And obviously at that consultation, we talked about the painful symptoms and basically the symptoms of Meniere's disease, ringing, fullness, dizziness, and to expect ringing, fullness, dizziness to go away. But, and this is really more cut and dried, is that because of the communication problem, because of her Hispanic background and language problems she had with me, because I don't speak Spanish or variations of it, Cuban. And so apparently she did not understand or get the message that her vertigo would take longer than the painful symptoms. So again, this was Maria. And Maria's initial symptoms were headache, earache, neck pain, jaw pain, tinnitus, fullness in the ears, vertigo, shoulder pain, arm, hand, finger tingling, numbness, and locking. And her device was delivered on 4/3, April 3rd, May 3rd, June 3rd. So she was right at 2 months, ready to come out of 24/7 into nighttime only, which is early in the follow-up, but would have expected, absolutely every expectation at that point in time would be the painful symptoms would be significantly diminished, where the patient could, when asked what percentage of your symptoms are diminished or gone, at that point in time, the average state would be in the 80s or 90%. And so we got talking with her through her granddaughter, and found that her vertigo, she just had 3 days before she came into the office, had a severe episode of vertigo that put her into the emergency room, emergency department, and they gave her some medication. and that it lasted for 2 days, and it really shook her up. Admittedly so. And I admitted there's the fact that that shook her up. But on investigation and talking with the patient about her other symptoms, which I won't go over again, her painful symptoms, and the other symptoms of tinnitus and fullness in the ear, subjective hearing loss, she admitted that, oh, those symptoms are just great, but it's really the vertigo that scared me. And it was one of the major symptoms that I wanted to get rid of, admittedly so. But she failed to understand whether it was my problem. I didn't get it across to her when we did the consultation, which I worked again through her granddaughter, or her granddaughter didn't translate it correctly, or she translated correctly, but misunderstood by the patient's point of view. However it occurred, that there was a misunderstanding about the timeline and expectations for these symptoms to resolve. In so doing, the patient presented to me with, on an emergency basis with extreme concern, and basically it was billed out to me on my schedule that patient is here to see you because she's not getting any response. She's not getting any response from wearing the device for 2 months, which is unheard of if they use the device according to the protocol. And actually, most people do. I'm not saying at all. The majority of people use it well, and they follow the protocol well. But there's about 20% that want to do their own thing one way or another. And there are about 2.5% that don't do anything and say they do. And that 2.5% are the ones we have the most problem with. The 20% that kind of want to do their own thing, well, they get a response, but it's not as good as it would be if they follow the protocol. And whether it's because they don't understand or they just want to do their own thing. And we all know that, patient compliance is a real problem in medicine. But getting back to this one case, this patient truly did not understand. She did not get the message one way or another that her vertigo is expected to resolve, but it may take significantly longer than the painful symptoms. And she had a reasonably good result by her statement about the tinnitus and the subjective hearing loss. But she had an episode of vertigo and it just threw her, and it was billed out to me on that appointment as the patient wasn't getting any response, which is just unheard of if patient will follow the protocol. So my point today is, and I'll just repeat the title here, the Urbanic device is a tool with instructions included. Now, what does that mean? It means that the instructions are available. And now the instructions are not cut and dry. And this device is not a plug and play thing, if you know what I mean by that. Plug and play. I mean, it's simple. You plug it in and it does all the work and you don't have to worry about it. Just plug it in and forget about it. Well, you can't do that, and expect to have good results. Obviously, the doctor has to know how it works, and he has to explain that to the patient and explain carefully the expectations and make sure that what he explains, the communication, is fully understood. And that is basically, the instructions. And these instructions are well placed. The instructions are concisely put within the course we give, the online course, which is now covered with 3 hours of continuing education credit. And you have to take the course to actually be qualified to use the device. And then the instructions are more spread out over our now 102 episodes of TMD Demystified, because I drill down on every specific aspect that I can think of regarding the device, how it works, how to treat a patient, what to expect, potential complications, things you can't do, the things you can do and should do are explained in detail. And each episode runs about 30 minutes. So after 102 102 episodes, we are now out to do the multiplication, 30 times 100. So, 3,000 minutes divided by 60 minutes. That's a lot of time, but it's good. It's time invested. And that's why I have made it a point to document it and record it, and to be as careful as I could that we cover all the features of the things that need to be understood, and that the instructions necessary that the doctor needs to give the patient and the patient needs to understand, so that we have excellent outcomes. And I just went over 3 examples that I saw yesterday, and they all happened within 3 hours, seeing these patients. And it dawned on me that I needed to bring this up again and make an episode regarding this issue. I hope I've made it clear. I hope I've given you 3 examples where it happens all the time. There's nobody, it's not a blame game I'm doing. It's a matter of understanding how important it is, understanding how to do it. And it's more of a art than a science, although there is some science to communicating. That's a whole course unto itself. But there's art and science to communicating both ways, to put it there for someone else and to receive an acknowledgement and to make sure that they understand what you're giving to them in the way of a communication. That cements the success of this tool. It's a tool. And if you use the tool correctly and you understand the instructions and you give the instructions and the instructions are understood, the success rate is extremely high. With that being said, I'd like to wrap it up today. Thank you for your attention. If you would like to comment about this, you can comment on the episode, on the podcast itself on Dentaltown. You can reach me directly at my email at tony@tmjservices.net. If you'd like to join our network of doctors who provide the device and protocol for their patients with the same results that we see here in Middle Tennessee, as you know, the device is patented, FDA approved, and you can learn more about it at our website, new branded website at www.urbanictmj.com. urbanictmj.com. If you'd like to communicate with our Director of Marketing and Education, that would be Dr. Naomi Engelman, who is a doctor of education. And I look forward to speaking with you. If you'd like to communicate, if you'd like to criticize, if you'd like to ask me questions, we're available here to help. With that being said, I look forward to speaking with you next week. I gave you an insight into some of the topics we're going to cover. I think you might find some of these really interesting. In my mind, especially what I have to say about periodontal disease and temporomandibular joint problems. There is a similarity, an important similarity between these two, which has been ignored, totally ignored. And it is extremely important that the dental profession know about this. With that being said, thank you very much. I look forward to speaking with you next time. I'm Tony Urbanic, and this is TMD Demystified.